Today we're going to be discussing exercise, activity, pain, and rest, which are chapters 34, 35, and 42 in your textbook. Exercise and physical activity are important for every body system. Exercise promotes independence, improves physical and mental well-being, and prevents loss of function. Some benefits of exercise include increased muscle strength, maintaining joint mobility, prevention of contractures, improved coordination to help prevent falls, improved self-image to help prevent depression, the ability to maintain or reduce weight, and improve circulation to prevent leg ulcers. A contracture is the permanent tightening of muscles that causes the joints to shorten and become very stiff. The CNA will assist the nurse and health team in promoting exercise and activity in all persons to the greatest extent possible. The care plan and assignment sheet include the person's activity level and assistance needed. Exercise prevents deconditioning. Deconditioning is the loss of muscle strength from inactivity. Bed rest means restricting a person to bed and limiting activity for health reasons. Common reasons to order bed rest are to reduce a patient's oxygen needs, reduce pain, reduce swelling, and promote healing. The types of bed rest are strict or complete bed rest with commode privileges, and bed rest with bathroom privileges. With strict or complete bed rest, everything is done for the person. All ADLs are completed in bed. When a patient is on bed rest with commode privileges, they are allowed to transfer from the bed to the bedside commode for elimination. When a person is on bed rest with bathroom privileges, they are allowed to ambulate to the bathroom and back to the bed. Some complications of bed rest include pressure injuries, constipation, fecal impaction, urinary tract infection, blood clot, pulmonary embolism, pneumonia, contractures, atrophy, and postural hypotension. A contracture is decreased motion and stiffness of a joint caused by shortening of a muscle. Atrophy is the decrease in size or wasting away of a tissue. Postural hypotension is abnormally low blood pressure when a person suddenly stands up. This picture here shows a bed board. Bed boards are placed under the mattress to prevent it from sagging. The bed boards are covered with canvas or other material. Many are hinged in the middle for use with hospital beds. A hinged bed board allows for the head of bed to be raised. Bed boards may be used in home settings by persons with back problems. So picture A shows a mattress sagging without a bed board. Picture B shows a bed board under the mattress without any sagging. And you can see the straight line on the patient's back indicates that the patient is in good alignment. This picture here shows a footboard. Footboards are padded boards or devices placed against the resident's feet to keep ankles and feet in proper position. Footboards prevent plantar flexion that can lead to foot drop. In plantar flexion, the foot is bent. Foot drop is when the foot falls down at the ankle. The footboard is placed so the soles of the feet are flush against it. Footboards also serve as bed cradles by keeping top linens off the feet and toes. These pictures show a backrest. Backrests are pillows or special wedge-shaped foam pillows that are used to provide support and maintain proper body alignment. These pictures are heel protectors. Heel protectors are padded protectors wrapped around the foot and ankle. They prevent rubbing, irritation, and pressure on the heel. Heel protectors maintain proper body alignment for the ankle and help prevent foot drop. This picture shows an elbow protector. An elbow protector is a padded protector wrapped around the elbow and arm. They prevent rubbing, irritation, and pressure on the elbow. This picture here shows a trochanter roll. Trochanter rolls prevent the hips and legs from turning outward, external rotation. A bath blanket or bath towel is folded to the desired length and rolled up tightly. The flat end is placed under the person from the hip to the knee. The roll is tucked alongside the body. This is a picture of a hip abduction wedge. A hip abduction wedge keeps the hips abducted or apart. The wedge is placed between the person's legs. The device is common after hip replacement surgery. This is a picture of a splint. Splints keep the elbows, wrists, thumbs, fingers, ankles, or knees in normal position. They are usually secured in place with Velcro. This picture here shows a hand roll and a finger cushion. Hand rolls or hand grips prevent contractures of the thumb, fingers, and wrist. Foam, rubber sponges, rubber balls, and finger cushions are also used. This is a picture of a bed cradle. A bed cradle keeps the weight of the top linens off the feet and toes. Heavy top linens can cause foot drop and pressure injuries. This picture shows the gentleman pulling up on a trapeze. Exercise helps prevent contractures, muscle atrophy, and other complications from bed rest. A trapeze is used for exercises to strengthen the muscles. The trapeze hangs from an overbed frame. The person grasps the bar with both hands to lift the trunk off the bed. The trapeze is also used to move up and turn in bed. Range of motion exercises refer to the movement of a joint to the extent possible without causing pain. The three types are active range of motion, passive range of motion, and active assistive range of motion. Active range of motion exercises are done by the person. The resident exercises his or her own joints without assistance. Passive range of motion exercises occur when the CNA moves the patient's joints through their range of motion. The staff exercises the resident's joints without assistance from the resident. Active assistive range of motion exercises occur when the patient does the exercise with some help. Some safety measures when providing range of motion exercises include providing warmth and privacy, exercising only the joints the nurse tells you to, using good body mechanics, exposing only the part being exercised, supporting the part being exercised at all times, moving the joint slowly, smoothly, and gently, not forcing the joint beyond its present range of motion, asking the person about pain or discomfort, and stopping if you meet resistance or suspect pain. The following things should be reported to the nurse: a joint that is red, swollen, painful, or draining, complaints of pain during range of motion exercises, lack of patient motivation, signs of withdrawal or depression, change in ability, both increased and decreased, change in resident strength, both increased or decreased, change in ability to perform range of motion exercises. The CNA should always withhold range of motion exercises for red, swollen joints. The nurse should be notified. This picture here shows abduction, adduction, flexion, and extension. Abduction is moving a body part away from the midline of the body. Adduction is moving a body part toward the midline of the body. Flexion is bending a body part. Extension is straightening a body part. These pictures are more examples of flexion and extension. Flexion is bending a body part. Extension is straightening a body part. Again, some more examples of flexion, extension, and abduction and adduction. Flexion is bending a body part. Extension is straightening a body part. Abduction is moving a body part away from the midline of the body. Adduction is moving a body part toward the midline of the body. Some more examples of abduction and adduction, flexion, extension. So abduction is moving a body part away from the midline of the body. Adduction is moving a body part toward the midline of the body. Flexion is bending a body part. Extension is straightening a body part. The middle picture shows opposition to the little finger. Opposition refers to touching the opposite finger with the thumb. So this picture shows hyperextension, which is excessive straightening of a body part. It shows abduction, which is moving a body part away from the midline of the body. Adduction, which is moving a body part toward the midline of the body. And the bottom pictures show internal and external rotation. Internal rotation is turning a joint inward. External rotation is turning a joint outward. This picture shows dorsiflexion and plantar flexion. Dorsiflexion refers to bending the toes and foot up at the ankle. Plantar flexion is bending the foot down at the ankle. This picture shows pronation and supination. Pronation is turning the joint downward. Supination is turning the joint upward. Ambulation is the act of walking. Assistive devices such as a cane or rolling walker may be required. The walking aid ordered depends on the person's condition, size, support needed, and type of disability. A physical therapist will teach the person how to use the device. These pictures show canes. So canes are used for weakness on one side of the body. They help to provide balance and support. There are single tip and 4-point or quad canes. A 4-point cane gives more support than a single tip cane but is harder to move. Picture A shows a single tip cane. Picture B shows a quad cane. When using a cane, the individual holds the cane on the strong side of the body. The cane tip is about 6 to 10 inches to the side of the strong foot. The cane tip is about 6 to 10 inches in front of the strong foot. The grip is level with the hip on the strong side. When using a cane, the person walks as follows. The cane on the strong side is moved forward 6 to 10 inches. The weak side is moved forward even with the cane. The strong side is moved forward and ahead of the cane in the weak leg. Always hold the cane on the strong side of the body. This here is a rolling walker. A walker gives more support than a cane. Wheeled walkers have wheels on the front legs and rubber tips on the back legs. Rubber tips on the back legs prevent the walker from moving while the person is standing. To walk, the person pushes the walker about 6 to 8 inches in front of the feet. These pictures show crutches. Crutches are used when the person cannot use one leg or when one or both legs need to gain strength. Some persons with permanent leg weakness can use crutches. Here are some guidelines for ambulatory assistive devices, such as canes, walkers, and crutches. Check the device for any defect or damage prior to use. The resident should always wear non-skid shoes that fit correctly when ambulating. Clothing should fit properly, meaning it shouldn't be too long or loose-fitting. The CNA must promptly clean up spills and clutter from the floors where the resident will be walking. The CNA should encourage the resident to stand as straight as possible when walking. The resident should not be rushed. The walker should not be used to hang items such as clothing. The resident should use the cane in the strong hand. When assisting a resident to walk, the CNA should stay near the resident on the weak side and have a chair available for the resident to use if he or she experiences pain or discomfort while ambulating. After walking, the CNA should return the resident to his or her chair or bed in low position with the call bell within reach. This picture shows orthotic devices. An orthotic device is used to support a muscle, promote a certain motion, or correct a deformity. They are used to keep joints in correct alignment and prevent contractures. Braces support weak body parts. They also prevent or correct deformities or prevent joint movement. A brace can be applied over the ankle, knee, or back. An AFO, ankle foot orthotic, is worn with the shoe. The AFO is secured with a Velcro strap. It's used for foot drop. This type of brace is common after a stroke. So an AFO is shown in the picture on the right side. Here are some rules for caring for an orthotic device. Do not immerse in water. Do not use hot water to clean. Clean with warm, damp cloth. Check braces and splints for wear and tear. If the device causes pain, remove and notify the nurse. And observe the area around and under the device for skin breakdown. Comfort versus pain. Comfort is a state of well-being. It's being with no physical or emotional pain. Pain is to ache, hurt, or be sore, or discomfort. There are many factors that affect pain. Pain is a warning sign from the body. Age, illness, and activity affect comfort. So do temperature, ventilation, noise, odors, and lighting. Such factors are controlled to meet the person's needs. Pain is a major factor affecting comfort. Pain is subjective. That is, you cannot see, hear, touch, or smell another person's pain. You must rely on what the person says. Pain is personal. That is, pain differs for each person. What hurts to one person may only ache to another. Per the Board of Nursing, pain is considered the fifth vital sign. Some factors that affect pain are past and current experiences. One's experiences and those of others help in learning about pain and what to expect. Anxiety. Pain can cause anxiety, which makes pain worse. Having the person understand the cause of pain and what to expect helps to reduce anxiety and lessen pain. Rest and sleep needs. Such needs increase with illness and injury. Pain seems worse when rest and sleep are affected. Attention. Pain seems worse when it is the person's main focus. Pain seems worse when there are no distractions. Personal and family duties. Some people try to ignore or deny pain because of a job, school, or caring for children. The meaning of pain. Pain can have different meanings. For example, pain can be a sign of weakness. It can be useful, such as getting someone out of school, or can lead to doting and pampering. Support from others. Dealing with pain is often easier when family and friends offer comfort and support. Culture. Culture affects pain responses. In some cultures, the patient needs to be stoic. Finally, illness. Some diseases affect pain sensations. The person may not feel pain. There are several types of pain. Acute pain is sharp or severe. It may be felt suddenly from injury, disease, trauma, or surgery. It may signal a new injury or a life-threatening event. There is tissue damage. Acute pain lasts a short time and lessens with healing. Chronic pain continues for a long time, longer than 12 weeks, occurs on and off, or is persistent. There is no longer tissue damage. Chronic pain remains long after healing. Arthritis is a common cause. Radiating pain is felt at the site of tissue damage and spreads to other areas. Referred pain is pain from a body part that is felt in another body part. For example, pain from a heart attack may be felt in the shoulder or left arm. The person may not have chest pain. Finally, phantom pain seems to come from a body part that is no longer there. Often occurs with amputations. The pain assessment is completed by the nurse. The CNA will report his or her observations to the nurse. Observations the nurse aide may make that indicate a resident is in pain include increased pulse, increased respiratory rate, and or increased blood pressure, sweating, nausea, vomiting, tightening of the jaw, frowning, groaning on movement, grinding teeth, increased restlessness, agitation, changes in behavior, crying, difficulty moving, or guarding an area. When the nurse does the pain assessment, they need to assess the site, They need to look at the onset, so when did the pain start, how long did it last? They need to assess the character, which just means have the person describe the pain. Is it aching, burning, cramping, crushing, discomfort, etc.? Does the pain radiate? What are the associated symptoms? So are there any other signs or symptoms associated with the pain, such as nausea, dizziness, or vomiting? The time and duration of the pain. How long has the person had the pain? When did it start? Any exacerbating factors. So what makes the pain worse? What makes it better? And then severity. Is the pain mild, moderate, or severe? What is the pain rating using a scale of 0 to 10? This top picture shows the pain scale. The nurse will ask the patient to rate his or her pain on a scale of 0 to 10, 0 being no pain, 10 being the worst pain imaginable. The bottom picture is the Wong-Baker Faces Pain Scale, which is used for children. You show them the picture and they point to the face that represents how much pain they are feeling. Some nursing measures for pain management. The first is distraction. Focus the person's attention on something unrelated to pain, such as music, games, singing, or TV. Relaxation is being free from physical and mental stress. This can be accomplished through deep breathing, a comfortable position, and a quiet environment. Guided imagery is creating and focusing on a relaxing image. With guided imagery, the person is asked to create a pleasant scene. This is noted in the care plan so that all staff use the same image. A calm, soft voice is used to help the person focus on the image. Soft music, a blanket for warmth, and a darkened room may help. The person is coached to focus on the image and to practice relaxation exercises. Hot and cold applications. Heat and cold applications are applied to the skin. They are used to promote healing, promote comfort, and reduce tissue swelling. Heat increases circulation. The tissues receive more oxygen and nutrients. It relieves pain, relaxes muscles, and decreases joint stiffness. Some complications include burns from high temperatures, excess redness and blisters. When the heat is applied too long, blood vessels constrict or narrow. Blood flow decreases, tissues receive less oxygen, tissue damage occurs, and the skin is pale. Older and fair-skinned persons have fragile skin that is easily burned. People with problems sensing heat and pain are also at risk. Metal implants impose risk. Metal conducts heat and deep tissues can be burned. Do not apply heat to an implant area. Heat is not applied to a pregnant woman's abdomen because it can affect fetal growth. When cold is applied to the skin, blood vessels constrict and blood flow decreases. It decreases circulation, which means tissues receive less oxygen and nutrients. Cold can reduce pain, prevent swelling, decrease circulation and bleeding, and cool the body when a fever is present. Complications of cold include pain, burns, blisters, and poor circulation. Burns and blisters occur from intense cold. They also occur from dry cold and direct contact with the skin. Older and fair-skinned people have fragile skin. They are at great risk for complications. So are persons with sensory impairments. Moist cold applications penetrate deeper than dry ones. Therefore, moist cold applications are warmer than dry cold applications. The cold compress is a moist cold application. It's filled with crushed ice. Dry cold applications include ice bags, ice collars, and ice gloves. Cold packs can be moist or dry applications. Commercial cold packs are single use, meaning disposable, or they can be reusable. It's important to protect the person from injury during heat and cold applications. Cover dry heat or cold applications before applying them. Provide for privacy. Maintain comfort and body alignment during the procedure. Know how long to leave the application in place. Heat and cold are applied no longer than 15 to 20 minutes. Place the call-light within the person's reach. Moist and dry heat applications. With the moist heat application, water has contact with the skin. Water conducts heat. Moist heat has greater and faster effects than dry heat. Heat penetrates deeper with a moist application. To prevent injury, moist heat applications have lower or cooler temperatures than dry heat applications. Moist heat applications include hot compresses, hot soaks, sitz baths, and hot packs. A compress is a soft pad applied over a body area. A hot soak is when a body part is in water. This is usually used for smaller parts such as the hand or a foot. A tub is used for larger areas. A sitz bath is when the perineal and rectal areas are immersed in warm or hot water. Sitz baths are common for hemorrhoids, after rectal or female pelvic surgeries, and after childbirth. A hot pack involves wrapping a body part with a wet or dry application. There are single-use or disposable hot packs and reusable packs. With dry heat applications, water does not have contact with the skin. A dry heat application stays at the desired temperature longer. Dry heat does not penetrate as deep as moist heat. Because water is not used, dry heat needs higher temperatures for the desired effect. Burns remain a risk. This picture here shows a back massage. The back massage can provide comfort and help relieve pain. It relaxes muscles and helps stimulate circulation. Good times for back massages are after repositioning and after baths and showers. Back massages last 3 to 5 minutes. Observe the skin before the massage. Look for breaks in the skin, bruises, reddened areas, and other signs of skin breakdown. Lotion reduces friction during the massage and softens the skin. Use firm strokes. Keep your hands in contact with the person's skin. Do not massage reddened bony areas. Wear gloves if the person's skin is not intact. The person is in prone position for a back massage. Stroke upward from the lower back toward the shoulders, down over the upper arms, back up the upper arms, across the shoulder, and down to the lower back. If the patient can't be prone, he or she can turn to the side. Rest means to be calm, at ease, and relaxed with no anxiety or stress. Rest may involve no activity or the person doing calming and relaxing things like reading or watching TV. To promote rest, meet physical needs such as thirst, hunger, and elimination. Meet safety and security needs by leaving the call light within reach. Meet love and belonging needs by allowing visits or calls from the family. And meet self-esteem needs by allowing the person to rest in their own sleepwear. Sleep is a state of reduced consciousness, reduced voluntary muscle activities, and lowered metabolism. Metabolism is the burning of food to produce energy for the body. Less energy is needed during sleep. Sleep is a basic need. The person thinks and functions better after sleep. Sleep is part of the circadian rhythm. Circadian rhythm involves a daily rhythm based on a 24-hour cycle that involves behavior, sleep, eating, and waking patterns. Called the day-night cycle or body rhythm, circadian rhythm affects functioning. Some factors affecting sleep are illness. During times of illness, sleep needs increase. Various signs and symptoms, care devices, treatments, and uncomfortable positions can interfere with sleep. Sleep needs increase with weight gain and decrease with weight loss. Drinks and foods with caffeine prevent sleep. Exercise helps people sleep well. Sleep needs vary for each age group. The amount of sleep needed decreases with age. The bed, pillows, noise, temperature, lighting, and sleeping partner are all part of a person's sleep setting. Any changes in the usual setting can interfere with sleep. Sleeping pills promote sleep. Drugs for anxiety, depression, and pain may cause sleep. Some drugs cause nightmares and vomiting. A stimulant prevents sleep. Lifestyle changes such as work, school, social event, and travel are some factors that can affect the person's sleep-wake times. Finally, emotional problems such as fear, worry, depression, and anxiety can affect sleep. Sleep disorders involve repeated sleep problems. The amount and quality of sleep are affected. Signs and symptoms include agitation, decreased attention, problems with coordination, fatigue, irritability, reduced memory, irregular pulse, decreased judgment, restlessness, and slurred speech. Insomnia is a chronic condition in which the person cannot sleep or stay asleep all night. Sleep deprivation is when the amount and quality of sleep are not adequate, causing reduced function and alertness. Sleepwalking is when the person leaves the bed and walks about while sleeping. With sleepwalking, the person is not aware of the event. The event lasts 3 to 4 minutes or longer. The person must be protected from injury because falls are a risk. It's important to awaken sleepwalkers gently because they startle easily. CNA should guide sleepwalkers back to bed. Finally, it's important to promote sleep. The CNA can plan care to allow the patient time for uninterrupted rest, allow for a flexible bedtime, ensure that the room is at a comfortable temperature. The patient should avoid caffeine. The patient should have clean, dry linens. The CNA should allow the patient to follow bedtime routines and rituals. A back massage can promote sleep. Reduced noise in a darkened room can also promote sleep. A flexible bedtime refers to bedtime when the person is tired, not at a set certain time. Routines and rituals refer to performing hygiene in a certain order, reading religious writings, praying, or saying a rosary before bed.